I stood in my bathroom 3 months postpartum, staring at my reflection as another wave of electric pain shot down my left leg. And I finally understood why I couldn't pick up my daughter without wanting to scream. The neurologist's words from yesterday's appointment kept replaying in my mind. This kind of nerve damage doesn't happen from a properly placed epidural. My hand trembled as I reached for the medical records I'd finally received that morning, the ones the hospital had delayed releasing for 12 weeks. Page 9 contained a single notation that made my stomach drop. Multiple insertion attempts, L3-L4, L4-L5, L5-S1. Patient experienced sharp bilateral pain during third attempt. Proceeded with catheter placement. They had stabbed me 3 times in the wrong places. I had told them something was wrong, and they had continued anyway. I think back to the woman I was 9 months ago, folding tiny onesies in the nursery, my pregnancy book stacked neatly on the nightstand with highlighted sections on pain management options. I had researched everything, read the epidural consent forms online, watched videos from anesthesiologists explaining the procedure, even toured the hospital's labor and delivery unit twice. My birth plan was color-coded. Green for preferred interventions, yellow for acceptable alternatives, red for absolute numbers. The epidural was in green. I wanted one. I had no fear of the needle or the process because I had educated myself, or so I thought. My husband Jake and I had interviewed 3 OB practices before choosing Dr. Martinez, who promised to respect my choices and support evidence-based care. I attended every prenatal class, did the kick counts religiously, ate well, exercised moderately. I was the model patient, the responsible mother-to-be. When my water broke at 39 weeks and 2 days, I remember smiling at Jake in the car, genuinely excited despite the contractions. I trusted my body, trusted my medical team, trusted the system completely. I had done everything right, prepared for everything I thought could go wrong. I had no idea what was waiting for me. We arrived at the hospital at 2 in the morning, my contractions steady at 5 minutes apart. The intake nurse, Maria, was warm and efficient, getting me into a gown and hooked up to monitors while asking about my birth preferences. I felt heard when she noted my requests for intermittent monitoring and delayed cord clamping. My labor progressed naturally for 6 hours, painful but manageable, exactly like the books described. I walked the halls, swayed on the birthing ball, breathed through each contraction with Jake coaching beside me. But around 8 in the morning, the contractions intensified to a level I hadn't anticipated, coming every 2 minutes with peaks that left me gasping. When Dr. Martinez checked me and said I was only at 6 centimeters, I felt my resolve weaken. "You're doing great," she said. "But you've got hours to go still. There's no shame in getting an epidural now." I looked at Jake, saw my own exhaustion reflected in his eyes, and nodded. I wanted the epidural. This was my choice, made freely and with full consent. What I didn't know was that the anesthesiologist who would perform it was finishing a 12-hour shift, and had already been flagged twice that year for complications. Dr. Patterson entered my room 40 minutes later, a tall man in his 50s who barely made eye contact as he mumbled through what I now know was supposed to be informed consent. He asked if I wanted an epidural. I said yes, and then he told me to sign a form while I was in the middle of a contraction. I remember trying to read it, but the words swam on the page as pain radiated through my abdomen. "Just standard consent," he said dismissively when I hesitated. "Same form thousands of women sign every day." I signed it. Looking back now, I can see that rushing me through consent during a contraction was deliberate. I was most vulnerable, least able to read or question anything. Jake had to leave the room per hospital policy. Another red flag I didn't recognize then. A nurse I'd never met stayed to help position me. "Curl forward like a shrimp," she instructed, holding my shoulders as another contraction peaked. I tried to stay still, my hospital gown open in the back, feeling exposed and afraid but trusting these were the experts who did this every single day. I felt the cold antiseptic swab on my lower back, then the sharp sting of the local anesthetic. "Little pinch," Dr. Patterson muttered. I breathed through it, hands gripping my knees trying to stay curved forward like they'd told me. Then I felt the pressure of the epidural needle going in, a strange sensation of something pushing into my spine. Suddenly, a lightning bolt of pain exploded down my left leg so intense I jerked forward involuntarily. "Ow! Something's wrong," I gasped, trying to pull away. The nurse's hands clamped down on my shoulders, holding me in place. "Stay still," she commanded. You moved and now he has to start over. Dr. Patterson said nothing, just withdrew the needle. I thought he would stop, reposition me, explain what happened. Instead, within seconds, I felt him pushing the needle in again. This time slightly higher. The same electric shock tore through my leg, worse this time, radiating from my spine down to my toes. I screamed. Stop. Please stop. Something's not right. My voice was desperate, tears streaming down my face, but the nurse just squeezed my shoulders harder. You need to stay still or this won't work, she said firmly, as if I was the problem. Why wasn't anyone listening to me? Dr. Patterson withdrew the needle again. I was sobbing now, my entire body shaking. But I felt the cold swab again and realized with horror that he was preparing for a third attempt. Please, I begged. Can we wait? Can we try something else? This doesn't feel right. He didn't even acknowledge I had spoken. I felt the needle pierce my skin again, pushing deeper, and then both my legs exploded in pain so severe I thought I was being electrocuted from the inside. I'm screaming no over and over, but nobody stops. The nurse is holding me down. Dr. Patterson is muttering something about patient movement, and I can feel the catheter threading into my spine despite every nerve in my body telling me this is wrong. This is dangerous, this is damaging me. The pain was unlike anything I'd experienced, not contraction pain but sharp electrical wrong. And then suddenly it stopped. There we go, Dr. Patterson said, as if nothing had happened. You'll feel relief in about 10 minutes. He was packing up his equipment before I could even process what had just occurred. My legs were tingling strangely, but not the normal epidural numbness I'd read about. This was pins and needles mixed with burning sensations that wouldn't stop. Jake came back into the room to find me crying uncontrollably, my body still trembling. What happened? He asked, alarmed, looking between me and the nurse. The epidural placement was a little difficult because she kept moving, the nurse explained calmly, her words rewriting reality right before my eyes. But it's in now and she'll feel better soon. I tried to tell Jake what had really happened. The 3 attempts, the electrical pain, my protests being ignored. But I was having another contraction and the words came out jumbled. The nurse gave me a look that clearly said I was being dramatic. Within 20 minutes, my contraction pain had dulled significantly, and everyone kept telling me the epidural was working great. But the burning, tingling sensation in my left leg never went away. I mentioned it to every nurse who came in during my labor. That's normal, they all said. It's just the medication. I thought maybe I was overreacting, that this was just how epidurals felt, that my 3 failed attempts were standard and I was being a difficult patient by complaining. I told myself they were the experts and I should be grateful the pain relief had finally kicked in. But something in my gut screamed that this wasn't normal, that the pain shooting down my leg had nothing to do with contractions and everything to do with what had been done to my spine. I delivered my daughter Emma 6 hours later. A beautiful 8-pound baby girl with a full head of dark hair. The joy of meeting her was real, but it was overshadowed by the fact that I couldn't feel my left leg properly. Not numb. I could feel touch and pressure, but every movement sent sharp pains through my lower back and down my thigh. It'll wear off, Dr. Martinez assured me when I expressed concern during my postpartum check. Epidurals take time to fully leave your system, but 24 hours later, when they wanted to discharge me, I still had shooting pains and a burning sensation that wouldn't quit. I could barely walk without limping. Some women have residual effects for a few days, the discharge nurse told me, handing me a packet of postpartum information that said nothing about nerve damage. My discharge papers listed uncomplicated vaginal delivery with epidural analgesia. That word, uncomplicated, would haunt me for months. Nobody wrote down the 3 attempts, the pain I'd reported, or my current symptoms. When I asked if I could see the anesthesiologist's notes, I was told I'd have to request my full medical records through the hospital's records department, a process that could take several weeks. I left the hospital with my newborn, a limp, and a growing fear that something was very wrong with my body. The pain didn't fade. 1 week postpartum, I called my OB's office because I couldn't stand for more than 5 minutes without electric shocks radiating down my left leg. The nurse told me it was probably just your body adjusting to not being pregnant anymore, and suggested I take ibuprofen. 2 weeks postpartum, I went to a walk-in clinic because I developed a numb patch on my outer thigh, and the burning sensation was constant. The doctor barely examined me before diagnosing postpartum muscle strain and prescribing physical therapy. At 3 weeks, I demanded an appointment with Dr. Martinez. She examined me briefly, pressed on my lower back, sending me through the roof in pain, and said, "Sometimes the epidural can cause temporary inflammation. Give it another month." I started to doubt myself. Was I being a hypochondriac? Was this normal and I was just weak? Every online search for epidural side effects showed temporary soreness, maybe a headache. Nothing like what I was experiencing. I joined a new moms group and casually mentioned my symptoms. Every other woman looked at me strangely. None of them had ongoing pain 3 weeks after their epidurals. That's when I knew for certain that what had happened to me wasn't normal, wasn't acceptable, and had been minimized by every medical professional I'd encountered since giving birth. At 2 months postpartum, I finally saw a neurologist after my primary care doctor agreed something was wrong. Dr. Chun performed a nerve conduction study that made me cry, not from pain but from validation. "You have nerve damage," she said gently, showing me the test results. "Consistent with trauma to the nerve roots at L4 and L5. This doesn't happen from a properly placed epidural." I broke down completely in her office. She was the first person in 2 months to believe me, to confirm that my pain was real and had a cause. She asked if I had my medical records from the delivery. I didn't. The hospital still hadn't sent them despite 3 requests. Dr. Chun wrote a letter on her official letterhead demanding my complete anesthesia records be released immediately. They arrived within 1 week. Reading them was like being violated all over again. The anesthesiologist had documented 3 separate insertion attempts, had noted that I complained of radicular pain during the procedure, medical speak for nerve pain, and then had proceeded anyway. There was no documentation of informed consent for multiple attempts. No note that he'd explained the risks of continuing after I experienced nerve pain. Nothing about offering to stop or try alternative pain management. Just clinical notations that I had moved and been uncooperative, painting me as the problem when I had been trying to protect my own body. My lawyer told me this happens because anesthesiologists are protected by hospital policies that rarely require them to stop a procedure once started, even if the patient is in distress. I learned that many hospitals have quotas, unspoken but real, encouraging epidurals because they're profitable and keep patients in bed, easier to manage. I discovered that anesthesiology errors are one of the least reported medical mistakes because proving causation is difficult, and the damage often doesn't show up until weeks later, outside the immediate hospital stay. When I joined a support group for medical trauma survivors, I met 4 other women who had nerve damage from epidurals. Every one of them told they were overreacting, or that their pain was normal postpartum adjustment. We all had similar stories. Multiple attempts, pain during placement, concerns dismissed, records that didn't match our experiences, and months of medical gaslighting before anyone would investigate. The pattern was systematic and it was devastating. I can't run anymore. I can't stand long enough to cook a full meal. I can't carry Emma in her car seat without my leg giving out. I'm 29 years old and I walk with a limp. The medical bills from specialists, physical therapy, and nerve pain medications have exceeded $15,000. None covered by insurance because they're classified as treating complications from elective anesthesia. I had to quit my job as a graphic designer because sitting at a desk for 8 hours sends my pain levels to unbearable. My relationship with Jake has been strained by my chronic pain, my inability to help with physical household tasks, and the anger that consumes me some days. I look at Emma and feel this overwhelming love mixed with rage that my body was damaged while bringing her into the world, damaged by someone who was supposed to help me, who ignored my pleas to stop. My case is still in mediation. The hospital is fighting the malpractice claim, arguing that nerve damage is a known risk of epidurals that I consented to. But I didn't consent to 3 attempts. I didn't consent to a procedure continuing after I reported severe nerve pain. I didn't consent to being held down and having my protests dismissed. What I wish I'd known then is that informed consent means more than signing a form during a contraction. It means having the risks explained in detail when I could actually comprehend them, having the right to stop a procedure at any time if I felt unsafe, and having my reports of pain taken seriously instead of dismissed as patient anxiety. I wish I'd known that I could demand to see the anesthesiologist's credentials, that I could ask how many attempts were standard before stopping, That I could refuse to proceed after the first failed attempt caused nerve pain. I didn't know I had those rights because nobody told me, and I was in the most vulnerable position of my life, in labor and pain, dependent on these people for my safety and my baby's safety. If you're pregnant and planning to get an epidural, I'm telling you this not to scare you away from pain relief, but to arm you with information I didn't have. Ask questions before labor starts. What is your hospital's policy on multiple epidural attempts? What happens if you experience nerve pain during placement? Can your partner stay in the room? Get these answers in writing. During the procedure, if you feel electrical or shooting pain, say, "I'm experiencing nerve pain and I need you to stop immediately." Use those exact words. Medical staff take documented nerve pain seriously. If they minimize your concerns or tell you to stay still while you're in severe pain, say clearly, "I do not consent to continuing this procedure. Remove the needle now." You have that right. After delivery, if you have ongoing numbness, tingling, burning, or shooting pains that last more than 48 hours, demand a neurology referral immediately. Don't let anyone tell you it's normal. Trust your body. Request your complete medical records, especially the anesthesia notes, before leaving the hospital. You're entitled to them. I'm sharing my story because the medical system counts on women not speaking up, on us doubting ourselves, on us accepting pain as part of motherhood. They count on us being too overwhelmed with a newborn to fight for answers or justice. But I'm fighting anyway. I've connected with birth advocacy groups pushing for legislation requiring video documentation of all epidural placements. I've testified at a state Senate hearing about informed consent in obstetric procedures. I've helped 3 other women obtain their medical records and find attorneys. My body may carry permanent nerve damage from that morning in the delivery room, but my voice, the one Dr. Patterson and his nurse tried so hard to silence when I screamed "stop," has never been louder. Because the most dangerous thing about my epidural wasn't the needle or the procedure itself. It was the systematic dismissal of my pain, my protests, and my autonomy. And that system only changes when we refuse to stay silent about what it did to us.